So first we're just going to visually inspect the pipette. Here we have a sterile disposable pipette that's typically used in cell and tissue culture. This one is a 5 milliliter pipette, and it is described in 1/10 milliliter increments, which means that the graduations are on it. So if we look between, say, 1 and 2 mils, there are going to be 10 graduations, each depicting 0.1 milliliters. Notice that on this pipette, the tip has its own volume included. So from here to here is 0.5 milliliter before the graduation starts. So if I fill up to this line, I have 1 milliliter. That is important because not all pipettes include this tip volume, so you always should check that you are using this kind of pipette before you pipette. Also, notice that the graduations extend beyond 5 milliliters. So 1, 2, 3, 4, 5, 6, 7, and a half. So this 5 milliliter pipette can actually measure 7.5 milliliters. Lastly, notice that on this pipette there's a white cotton swab at the tip. This is to help keep the pipette sterile when you use tissue culture reagents, but doesn't really matter for our purposes. Next we have the pumps. So pipettes use pumps to help aspirate and release liquids from them. A sliding pump, kind of like this one, exactly like this one, are common in learning labs. They're cheap, they're efficient. We also have other variations of it, so sliding and more sliding. In research labs, they tend to use electrical pumps, so call them pipetters like this. Or in older settings, you might see these bulbs, which you can use to very cleanly and precisely pipette. So we're going to mostly use these, which are 5 to 10 milliliter pumps in our labs, and because they're made to pipette 5 to 10 milliliters, if you use them with our really small 2 milliliter pipettes, you need to be careful not to over pipette with them. To use a pipette, you need to attach it to your pump and check that it's properly sealed. So the sitting, just kind of push it on here gently. You don't need to push very hard. The pipette only needs to go in about that far. Make sure it's snug, so if you rotate it, it should spin with the pipette. There should be no wiggling here, and it shouldn't be very wobbly either. So when you are pipetting, typically you use one hand to hold the pipette, to guide it, and the other hand to pump with. So you just put the tip into the liquid, and then you gently use the pump. When you're pipetting, do not push the tip all the way into the solution. Like, I don't need it to touch the bottom. That'll just get water up on the sides of this, which can mess up your volume transfer. You want to slowly and smoothly aspirate. If I pull on this really fast, like, I can get air bubbles in there if I don't keep up with the water level. It can slosh. Also, be very careful when you're pipetting that you don't get water into your cotton swab or up into your pump, which can jeopardize the seal and make it very difficult to continue pipetting until the pump dries. So to measure the volume you pipette, you want to measure from the bottom of the meniscus. So I'm going to suck up some water here. And so from the bottom of the meniscus, this should reach, I guess it's going to be hard because my camera's at an angle here, but it should be even with this graduation. So I have in here 6 milliliters. Lastly, I just want to talk about if your pipette is too large for your pipette pump, you can suck up as much as you can in it and then take off the pump and very quickly tap the top of it. It'll stop the liquid from flowing out. Then you just reset your pump, and as quick as you can, stick it back on there, and you can suck up more. Then when you go to dispense it, you'll probably want to just remove the lid because there'll be a lot in there. So once you have your liquid in here, we're going to move the pipette to the transfer container. Typically you want to put it on the bottom if it's a flask or a beaker. In the case of a test tube, I'm going to try to put it on the side. But the idea here is that you don't want to just splash your solution in there. So if I put this right in the middle and drop it, notice how it's splashing, it's making bubbles. If I put it on the side of the container, it'll drain neatly and cleanly in. Alternatively, you can put it right in the solution. You just need to be careful not to drown it. Now I'm just going to get the rest of it out of there. Now notice how there is still some left in the tip. If you pipette up and straight back down, this is always going to happen. The pipettes are not calibrated for this, I think. So you do want to blow that out. So if you just take your pump and take it off and put it back on, just the act of putting it back on will force air through there. Alternatively, you can suck up liquid beforehand, so just pull up, make a little cushion, and then when you suck it up, you'll have that cushion of air, so you'll still have force left to push it out. And notice that I'm doing a bad here by not pipetting it along the wall. So lastly, depending on your workflow, you might be able to reuse a pipette. In this case, I'm just pipetting dyes around, so if I want to switch dye colors, I can probably just rinse my pipette. So I have some rinse water here. Just droop, droop. Maybe do that a few times, and that'll be good to go. Alternatively, if I'm working with something sensitive, like tissue culture or other stocks where back contamination is a serious risk, I can just simply dispose of the pipette. Typically, we re-sleeve them, and we put them in the appropriate waste receptacle. Now, depending on our labs, we might reuse the pipettes between sections to save on resources and the environment because these are plastic. So that concludes our serological pipetting video. Thank you for watching.